Okay, so the topic that I've chosen for this assignment is safe nurse to patient staffing ratios. I'm going to go over pretty much the benefits of how making a law in North Carolina for safe staffing ratios at inpatient facilities will reduce negative patient outcomes. Just a little bit of information. Identifying and maintaining the appropriate number of nursing staff is critical to the delivery of quality patient care. Numerous studies reveal an association between higher levels of experienced RN staffing and lower rates of adverse patient outcomes. When healthcare employers fail to recognize the association between RN staffing and patient outcomes, laws and regulations become necessary. So below is a picture that represents the states that have plans in place to protect against unsafe nurse-to-patient ratios. As you can see, North Carolina is not one of them. Safe nurse-to-patient ratios decrease medical and medication errors. They decrease patient complications, decrease mortality, improve patient satisfaction, reduce nurse fatigue, decrease nurse burnout, and improve nurse retention and job satisfaction. The steps to creating laws in states, they consist of 3 different steps. The first is to require hospitals to have a nurse-driven staffing committee, which they create staffing plans that reflect the needs of the patient population and match the skills and experience of the staff. Secondly, legislators need to mandate specific nurse-to-patient ratios in legislation or regulation. And also, hospital facilities are required to disclose their staffing ratios and information to the public or a regulatory body. I know that in the hospital that I work at, we do have staffing committees, and we have like a plan that kind of goes by what our budget is, that we are allowed to have so many nurses for so many patients. But the problem is that we don't always go by that, and that they don't give us in our budget the actual RN positions to be able to fulfill that. So we are a lot of the time short-staffed. The last few months have been really busy for us, and plus we've been short-staffed. So I work on a mother-baby unit, and we typically have 400 to 500 deliveries a month. I work in downtown Charlotte at a pretty big hospital, and we're the public hospital in Charlotte, so we receive all the Medicaid and self-pay patients. And for October, as of like October 20th, there were already 630 deliveries for this month. So we have been super busy, and then on top of that, been short-staffed. I work on the postpartum unit, but they've also been short-staffed in L&D, where they would have 3 patients to 1 nurse, and that is not safe when you have laboring patients, because things can change within an instant, and babies' lives can be put at danger, moms' lives can be put at danger. It's a very scary time for them. And then also for us on the postpartum side, typically the recommended amount of patients that we're supposed to take is 6, and it's usually 3 moms and 3 babies, so 3 couplets. And we are most nights going up to 8 and 10 patients a piece. So it's just a lot of stress on the nurses. I feel that the safe nurse-to-patient staffing ratios would definitely help decrease that stress on the nurses and be able to provide better patient care to the patients. I know that the research that I did on the state officials, I could not find anything saying that they even held a stance on this issue. So that's a problem in itself, that we need to make this problem more known, and that's why I've chosen to write my letter to the state legislature about this issue. Thank you.